Vaccination. The COVID-19 pandemic has led to countries in lockdowns and people living in self-isolation across the globe. COVID-19 is caused by SARS-CoV-2, which is a type of virus, and it was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China, and the outbreak was first reported on 31st December 2019. To minimize the chances of getting the virus, we have to take vaccination, and blood pressure needs to be measured before taking the vaccination. This is to know the condition of the patient and see whether they are suitable to take the vaccine or not. Hypertension, or also known as high or raised blood pressure, is a condition in which the force of the blood against the artery walls is too high. It is a serious condition, and if left untreated, it can lead to heart and kidney diseases as well as stroke. It is the most common comorbidity, which means a disease or medical condition that is simultaneously present with another or others in a patient among COVID-19 patients. An uncontrolled high blood pressure is more likely to develop severe COVID-19 infection. In some cases, people with hypertension are discouraged to get the vaccine as it is riskier and it lowers our body immunity and increases the risk of lung injury.
The prevalence of high blood pressure, otherwise known as hypertension, has been on the rise. An estimated 1.28 billion adults aged 30 to 79 years old worldwide have hypertension. Most, around 2/3, live in low and middle-income countries. These staggering figures underline the importance for us to regularly check for our blood pressure. But the question is, how would we do that when going to the hospital would put us at a greater risk?
Hello, my name is Natashya.
And my name is Ariella.
And today we are going to be talking about Sphygmomanometer, which is also commonly known as blood pressure monitor.
Before we get to how a sphygmomanometer works, we need to know what blood pressure is and how it arises. By definition, blood pressure is the force of your blood pushing against the walls of your arteries. A sphygmomanometer measures two types of blood pressure, namely systolic pressure and diastolic pressure. Systolic pressure is the pressure of the blood when the heart is in the stage of systole during cardiac cycle. Simply put, systole is a period of time when the heart contracts. Diastolic pressure is the blood pressure when the heart is relaxing or during its diastole stage. You would expect the diastolic pressure to be lower than the systolic pressure. Usually, a sphygmomanometer measures the pressure of the blood inside the brachial artery. The brachial artery is located near the upper arm, or specifically in the inside bend of the elbow. Sphygmomanometers are broadly classified into two categories, manual and automatic. There are two types of manual sphygmomanometers, mercury and aneroid. These types of sphygmomanometers are usually used along with a stethoscope, and the stethoscope is used to hear the sound of the blood pounding through the artery. Mercury sphygmomanometers are considered the gold standard. They indicate pressure with a column of mercury, which does not require any recalibration. Aneroid sphygmomanometers are in common use in most hospitals, and they may require recalibration checks, unlike a mercury sphygmomanometer. Aneroid sphygmomanometers usually depart from their calibration when they strike or jar against other objects.
There are also two types of automatic sphygmomanometers. The first one is the upper arm model, which is shown in the slide, and the second one is the wrist model. But today, we're just going to be explaining for the upper arm model as it is more commonly used.
Both manual and digital sphygmomanometers have a cuff, which is the inflatable part that is placed around the patient's arm. It fills with air to apply pressure to the arm and limit the amount of blood flow to the area being monitored. Manual sphygmomanometers have an additional component, such as the bulb. The bulb is made up of rubber and it's squeezed repeatedly to allow air pressure to build up in the cuff. At the base of the tubing, you can also find a valve near the bulb, and this valve can be closed or open in order to release or to secure air pressure inside of the cuff. Finally, there's the measuring unit, which is the mercury manometer in a mercury sphygmomanometer or an aneroid gauge. Now I'll be explaining how a manual sphygmomanometer works. The sphygmomanometer cuff is inflated to well above the systolic pressure. So usually the doctor or the nurse or whoever the examiner is would ask the patient what their last systolic pressure was. And afterwards, they would inflate the cuff until the pressure is well above the systolic pressure. However, if the person does not know what their last systolic pressure was because they forgot or maybe because they haven't got it checked, then the examiner would pump the bulb or pump the cuff until its pressure reaches around 180 millimeters of mercury. This is done in order to anticipate any cases where the systolic pressure is above the normal pressure, which is 120 millimeters of mercury. After putting the cuff in and placing the arms, a stethoscope is placed underneath the cuff. And this stethoscope is placed around the inside of the elbow where the brachial artery is found, right over here. Air is pumped into the cuff by squeezing on the rubber bulb attached to the BP monitor. This increases the pressure around the arm, which causes the diameter of the artery to narrow, and eventually arterial blood flow is stopped. When the arterial blood flow is stopped, no more sound can be heard from the stethoscope. Soon after, air pressure is slowly released around 2 millimeters of mercury at a time by twisting a valve open near the bulb, and this action deflates the cuff. The reduction in the pressure causes the artery to widen until eventually blood starts to flow again. When blood starts to flow for the first time, a faint tapping sound is heard through the stethoscope, and it sounds like this. This sound is known as the Garnikov sound. When this sound is heard, the pressure reading of the cuff is recorded as the systolic pressure. This indicates that the maximum output pressure generated by the heart while it's pumping is equal to that much. The examiner then continues to open the valve slowly to deflate it further. When no more sound is heard through the stethoscope, the pressure reading of the cuff at this particular instant is recorded as the diastolic pressure. The blood flow now has become silent because the artery is no longer compressed. This method of measuring blood pressure is called the auscultatory method, as it involves using a stethoscope to detect Kornikov sounds. When using the auscultatory method, you can hear 4 different sounds, each belonging to a different phase of blood flow in the artery. In phase 1, a faint tapping sound is heard. And as you can see on the diagram to your left, this sound is produced when the pressure inside the cuff equals the blood's maximum pressure, which is the systolic pressure. In phase 2, a slightly louder swishing sound is heard, and it sounds like this. In phase 3, a loud knocking sound is heard, and it sounds like this. In phase 4, a muffled sound is heard. It sounds like this. And lastly, in phase 5, no more sound is heard, and in this instant, the pressure inside the cuff equals to the blood's diastolic pressure. So by now, I hope you've understood the working mechanism of a manual sphygmomanometer and also the auscultatory method. Now let's try to measure blood pressure using an Android sphygmomanometer and try to solve it on your own. Remember, note the pressure reading when the first tapping sound is heard and also when you can no longer hear the sound. In this monitor, each scale represents 2 millimeters of mercury. Okay, so I hope you've noted down your pressure readings, and if you haven't, well, you can always go over the video again. but if you have, let's check your answer. If your answer is 212 over 132, meaning the systolic pressure is 212 and the diastolic pressure is 132 millimeters of mercury, then your answer is correct.
So far, we know how a manual sphygmomanometer works, but is the mechanism the same for digital sphygmomanometer? Let's see, shall we? So, for the digital sphygmomanometer, it uses the oscillometric method, in which it uses an air pump to inflate a cuff surrounding an upper arm or a wrist with sufficient pressure to prevent blood flow in the local main artery. This pressure is then gradually released using a digitally controlled solenoid valve until the moment that the blood begins to flow through the artery. The blood pressure measured by a pressure sensor at this point determines the systolic pressure. Pulse rate is also sensed at this time, and the measurement taken when the blood flow is no longer restricted determines the diastolic pressure. This complete measurement cycle is controlled automatically by the microcontroller. Let's take a look at the features of a digital sphygmomanometer. A sphygmomanometer measures two types of blood pressure, which is the systolic and diastolic pressure. As mentioned before, systolic is the blood pressure when the heart contracts, and diastolic is the blood pressure when the heart relaxes. Other than measuring our blood pressure, it can also measure our pulse rate. Now let's take a look at the other mini features in a digital sphygmomanometer. So first, we have the last memory, and it is for easy reference. We can just press and hold the start/stop button for 5 seconds to see last measurement value. Next, we have the hypertension indicator, and it will blink when the measurement is displayed if your systolic or diastolic pressure is outside of the normal range. Next, we have the cuff wrapping guide, and it guides user to the right cuff wrap by indicating OK. This feature ensures an accurate and reliable blood pressure measurement. So, if our cuff is correctly wrapped, it will appear in a symbol of OK, as we can see on the left side corner, and it will appear in another symbol if our cuff is wrapped too loosely, as we can see on the right side corner. Next, we have the irregular heartbeat detection, and it helps to detect any abnormal rhythm of your heartbeat, so you can consult your doctor for early diagnosis and treatment. Next, we have the body movement detection, and it alerts you of any body movement that will affect readings. And lastly, it is simple to use, as one touch button makes it easy for you to monitor your blood pressure daily. This is a demonstration video on how we can use the automatic blood pressure monitor. So first, as we can see here, there's an air plug. And then, we have to insert the air plug into the air jack, and remember that we have to insert it securely. Next, we can apply the arm cuff, and to do so, we have to put our arm through the cuff loop. Then we can close the fabric fastener firmly. As we can see here, there's a marker arrow under the air tube, and it should be centered on the middle of our inner arm. We should also sit comfortably, and our arms should be supported. Now, we can just press the start/stop button, and the arm cuff will start to inflate automatically. And after we see our reading, we can then just press the start/stop button to turn the monitor off.
So, you've got your results, but how do you interpret them? Blood pressure falls under one of the 5 categories, namely healthy, elevated, stage 1 hypertension, stage 2 hypertension, as well as the hypertensive crisis stage. A healthy blood pressure reading is less than 120 over 80 millimeters of mercury. An elevated blood pressure reading has a systolic number of 120 to 129 millimeters of mercury, and the diastolic number is around less than 80 millimeters of mercury. Stage 1 hypertension has a systolic number of between 130 to 139 millimeters of mercury. The diastolic number is between 80 to 89 millimeters of mercury. Stage 2 hypertension has a systolic number of 140 millimeters of mercury or higher, and the diastolic number is around 90 millimeters of mercury or higher. In a hypertensive crisis, the systolic number is well over 180 millimeters of mercury, and the diastolic number is over 120 millimeters of mercury.
Let's take a look at the pros and cons of automated and manual sphygmomanometer. So first, for the pros of automated sphygmomanometer, it is easy of use and it is suitable for household uses. Next, it is also easy to use in small children. And for the cons of automated sphygmomanometer, it is not the most accurate and there might be manufacturer variability.
So let's start with the pros. Manual sphygmomanometers give more accurate readings when they're used properly. What does it mean by used properly? It means the sphygmomanometer is well calibrated and it has the correct cuff size. It is also used by a trained personnel like a doctor or a nurse or someone who's been trained to measure blood pressures. The study has shown that automated blood pressure monitors seem to provide inaccurate readings in 5 to 15% of people. Due to its accuracy, manual sphygmomanometers are also good for confirming hypertension. Cons. Since using manual sphygmomanometers require examiners to hear cough sounds in order to hear or record the blood pressure reading, any noise that might interfere with the cough sounds may lead to incorrect pressure readings. Mercury sphygmomanometers must also be handled with extra care because mercury vapors are dangerous to inhale.
Significance. So why is knowing blood pressure important? High blood pressure is one of the biggest global health problems, and blood pressure control is key to reducing disease burdens such as heart disease, stroke, and kidney failure. Blood pressure can also help in medical diagnosis, which means determining which disease or condition explains a person's symptoms and signs. If we know our blood pressure, it can also help in the prevention and treatment of disease. And it is also for long-term epidemiological studies, which is relating to the branch of medicine which deals with the incidence, distribution, and control of diseases.
Now you might ask, how would this knowledge on sphygmomanometer, a name that is very difficult to pronounce, would even be beneficial to you? To answer this question, I'd like to ask you 2 questions. First, do you have a history of high blood pressure in your family? Second question, are you afraid of going to the hospital to get checked for your blood pressure because of COVID-19? Well, if you answered yes to any of these questions, then I can say that your knowledge on sphygmomanometers will definitely help you. Knowing how to operate a sphygmomanometer and interpret its results allow us to check for our blood pressure and see if it's within the normal range without having to book an appointment at a hospital. If it was above the normal range, then you would be able to take early, preemptive, and precautionary measures to get it treated before the condition exacerbates into a much more severe illness. And on top of that, it will not only be beneficial to you, but the knowledge will also be beneficial to your family members. And that concludes the end of our presentation.
Thank you.